Hello and welcome. Today, I have Dr. Renee on our podcast, just here to talk about her experience with IVF as an OBGYN herself, and the changes that she made in her diet, her nutrition, her lifestyle that catapulted her success on her 14th round of IVF. So I am so stoked to have her here, her education and her training, and then her journey into motherhood has scoped in a completely different perspective than her vision and experience before she became a mother. So I feel your message is so powerful, Renee, and having you here to speak to different women who have experienced this longer journey to fertility, right? And perhaps even had been known or had gotten the diagnosis of infertility, right? Like how that can hit in the heart, those that whole process of like, gosh, that lonesomeness and this like desperation and feeling like you don't know how to find yourself, but you have this deep desire to be a mother. And although I personally never struggled with IVF, man, there were times or with infertility, there were times just because I saw a Google review that said I wasn't pregnant by a certain amount of day and time, even though I wasn't having unprotected intercourse, that I actually convinced myself that I was infertile. And so I was like, there is not enough information. We're not taught enough about our menstrual cycle to really understand. Are we even ovulating? Is this even an ideal time? Does this even make sense? Are we even nourishing ourself, our body, managing stress in a way that's actually conducive to creating this environment that can carry a baby?
Right.
So there's a lot to it. So welcome. And I would love to jump in. You kind of started talking to me about your education and training and how this world was really different, the world of medicine, and even being a professional and also having the hope of being a mother too. So having like making your cake, having your cake, eating it too, right? Like whatever that phrase is, like you think you can do it all, like both professionally and being a mother. And you were kind of cueing in on how this really changed your perspective. So I love to hear more.
Absolutely. We were talking a little bit offline. You had just shared with me that when you would go to OBGYN appointments and speak with the OBGYN physicians, a lot of them were not mothers themselves,
Yeah.
um, but yet they were, charged with your care, ensuring that they were able to get you a healthy baby and also to keep you healthy throughout the pregnancy process.
Mm-hmm.
Said to you that that I'm not surprised to hear you saying that most of the female doctors that was caring for you, they weren't women themselves, and not women themselves but mothers themselves.
Yes.
Not surprising to me, and I told you that there was a reason for it, and
Yeah.
I feel that the reason for it is because, and you touched on this, and I'm just going to speak honest, my truth. And I know that some people are not going to like this. They may not agree with me, but this is my truth. As women, we are told or we believe that we can have it all.
Mm-hmm.
Um, and we can't,
Mm-hmm.
not without certain sacrifices and not without strategic planning.
Mm-hmm.
And it's as simple as that. So I'm going to give my example. Half of my life, half of my adult life, my early adult life was dedicated towards training, education and training to become a board certified OBGYN physician. I'm licensed in the state of Georgia. I live here in Atlanta now in Georgia, but I was raised in Canada. So I did my bachelor's degree at McMaster University in Hamilton, Ontario. I did a master's degree at University of Toronto. And then I matriculated for medical school at Michigan State College of Human Medicine. So right there, that's 4 years. That's my
Mm-hmm.
master's degree was 2 years. My medical degree was 4 years. And then after all that, you still have to do residency training in something. So as an OBGYN in the United States, it's 4 years for you to become a general OB. And so I did that. So you can just add that up right there, how many years, right?
Yeah.
During that time, as especially as women, we are not adequately counseled and just given the real truth that if you want to do this, you want to get on this path and dedicate so much of your life and this delayed satisfaction to become a physician, that's great.
Mm-hmm.
You want to be a mother too? then you need to start to think strategically because you're not going to be able to have it all. Do
Mm-hmm.
not be eluded and think, or deluded, I should say, and think that you doing, what did I do? Like 16 years of training.
Mm-hmm.
That when you're done with all of that, and whenever that time is that you think is the perfect time, because after training, then you have to establish yourself in your career, right? So either you're
Right.
a young attending physician on faculty at a medical school, helping others to train other medical students, residents in your specialty, or you decide to go into private practice, you are still young in your career, and
Mm-hmm.
that takes time to build. So how many years are you going to dedicate towards that? So we've now added that to that time frame. And whenever you decide it's time for you to become a mother, you're now how many years older? You've
Right.
delayed that journey or that goal that you have as a woman for so many years.
Right.
Now you've decided, okay, I want to be a mom.
Yeah.
Well, our bodies have a different story because during all that time that you are training and delaying your life, your real life, because you're actually
Yeah.
living while you're doing that, your body is aging. Your ovaries are is aging. Your eggs, there's a process that it goes through called atresia because we are born with a certain amount of eggs. That we have the most eggs while we're in utero as
Yes.
as a female. That is the most eggs you will ever have in your life. Once you're born, some of your eggs have already died off, a lot of them,
Yes. Right.
right? And
Right.
then over the course of a woman's life, if she is menstruating appropriately every month, because menstrual cycles is like a fifth vital sign, that is
Yeah.
the way that you can figure out if you're healthy or not,
Yes.
right? So if she's menstruating appropriately over the course of her life, she's going to probably release about 4 to 500. This is what the research shows. About 4 to 500 eggs in the course of her lifetime. She's going to lose millions more than that. So
Mm-hmm.
by the time you now have gone through all those years of training,
Mm-hmm.
have established yourself for the first few years as OBGYN using and now you want to have a baby, your body is much older. You've lost a lot of eggs. Maybe the egg quality, the eggs that are remaining are not as the same quality as it was when you were younger. And now
Mm.
it's be ever more harder for you to get pregnant.
Mm-hmm.
And
And
yeah, go
yeah,
ahead.
and that's not even including like the actual, like you said to me, like, or you said your own life when you're actually living, because you said there's a part where
You're
you're not
not.
really living, you're actually just showing up, training,
You're
training, training.
delaying.
You're delaying your life in a way. Yes,
But it's your
it's
life.
interesting. Yeah, it's interesting perspective of like I'm not actually living during this time. I'm literally just like absorbing, like being dumped in and having to stress. So why I say that is because the level of stress during those 16 years of training is
Is
insane.
astronomical. So even that, so
Yes,
many years of training.
yes,
I'm so glad you brought that up, Carly.
yes,
So all those years of training, that the stress that you're going through for long, chronic periods of time,
right.
do you not think that that's going to have an impact on your body?
Exactly. Adrenal
No.
fatigue, hormone imbalances, any of the issues that come along with that high level of stress, because our school system and training isn't set up for women to
It's
understand that we have different phases in our menstrual cycle where we can't take on extra stress. Our testosterone production isn't up to there. Like,
or or if you do try to conceive during those periods, you're not going to be successful. So
right?
people are not being honest. We're
Yeah.
not having the real honest conversations with young women who
Hmm.
want to become professionals. And I want more young women to be professionals,
Hmm.
okay? Or to do what you want to do. It doesn't mean that you have to get all these degrees like I did. You
Hmm.
want to go and build an online business, go at it. It's going to take some time for you to be successful in that. So you know you're going to dedicate time.
Hmm.
Whatever you're dedicating your life to, you're still living your life. It's
Hmm.
still your life, okay?
Yeah,
Because
yeah.
you could walk out that door while you're training or in medical school and get hit by a car and life's over, right? It's
Yeah,
your life,
yeah.
right? So we need to have these discussions where, okay, you have a really honest discussion with yourself. Do you want to be a mom? Is this something that you see for
Mhm.
yourself down the road? Is this something that you feel that if you do not have this experience, this part of this life journey that a huge part of you, essence of you will be missing. Because for me, that was what it was. I knew that I always wanted to be a mom, right? But
Mm.
I knew also that I always wanted to be a physician. I knew from when I was 13 that I wanted to deliver babies. I knew specifically what type of doctor that I wanted to be. And I said on the
Wow.
course, but no one sat down to me and said, Renee, do you also want to be a mom? If you want to be a mom, then you have to start to think strategically while you are doing all the things that
Yeah.
you need to do in order to get to what you want to get to professionally. And
Right.
that,
Like either, and what I have a question for you. Because
yeah,
I'm actually writing a book right now, and I study a lot of the psychology of our decisions and how to kind of reprogram and get these things, our needs met.
yeah.
So if somebody were to sit you down and say, Renee, you want this career as a physician, but you want this baby, and you've been playing baby and you've been playing mommy. I think I know the answer because where you are right now in your life. But would you have done it differently where you would have set it aside and been like, no, I do want to be a mom more?
I would have done so many things differently, which is what I'm saying. Like I would have, and not everyone has these resources, but you
Yeah.
have to have real honest conversation with yourself and be very honest in the answers.
Hmm.
And then you have to be strategic in your planning. So it may
Right.
look differently for everyone. For me, I may have used my resources to start to freeze my eggs earlier in my journey because I did do it one time, but I was
Mm.
much older. I was like in my mid to late 30s, and by then, I my eggs were not the same as where they were maybe 5 years earlier. So I would have done that earlier. That would have been my choice. But for another woman, maybe it means that she's going to start to have her babies earlier in her career. So maybe
Right.
it's because I know some people who had babies in medical school. Even though we looked at them and we thought they were crazy, they were actually smart. When I was
Right.
going through it, I was like, she's nuts. How the hell is she doing that? She was smart, okay?
Yeah.
Or having it your baby in residency. So that's another option. If you don't have the money to freeze your eggs,
Yeah.
then start to have your kids earlier and work your family life into everything that you want for yourself as a woman professionally.
Right.
But do not be deluded in thinking that you can have it all. Don't be
Right.
deluded in thinking that by the time you're done this 15 to 20-year journey,
Yeah.
that think that the next month when you decide it's time for you to conceive,
You're
that you're
gonna
going
get
to
pregnant.
no, you're
Right.
not.
Right. So that kind of led you, this is kind of is the premise of your story is, you were focused on your career, you were doing all these technical trainings, focusing on being a doctor. Now, when you decided you wanted to conceive Caleb, you were already in as a family
I was
OBGYN.
attending. So I was
Okay.
attending. I'm a board certified OBGYN physician.
Mm-hmm.
So I was already practicing in clinical medicine,
Mm-hmm.
working, and and with that
Mm-hmm.
came chronic stress because the
Mm-hmm.
type of um, clinical practice that I chose to, at that time when I decided to start to try to get pregnant, I was an OBGYN hospitalist. And what that is someone think of as an OBGYN who only works in the hospital, so not in the clinic.
Okay.
They're only working on patients who are in the hospital, but it's more emergent care. So
So
because they
more
don't
like a miscarriage and or emergency C-section. Okay. Okay. I
I
see.
wouldn't know. Most times, I don't know the patient from Adam. So
Right.
it's kind
Right.
of like think of someone like an ER doctor. You know how you go
Yeah.
in emergency, you're meeting that doctor.
For
The
the
doctor,
first time.
that's
Yes.
exactly what an OBGYN hospitalist is. It's a model that started, and I was one of the first adopters for this model because I truly believe in it.
Hmm.
In order to be a safety net for mothers and their babies during labor. So it's a
Hmm.
model, and back then I entered into it in 2012.
Hmm.
I became an OBGYN hospitalist. It was one of the first contracted programs in the state of Georgia.
Hmm.
And what my program how it was structured and how the other programs were structured that I became a part of and helped develop was that it was 24-hour call shifts.
Hmm.
And so you did anywhere between 7 to, at one point, I was working 10 of those a month. But it
Wow.
gave you a lot of freedom in that the days that you're off, you're off. So you
Right.
don't have to worry about your pager or, looking up labs or anything because there's another OBGYN who's on call or who's on. It's their
Hmm.
time to be on. They're 24 hours on and they handle everything for our practice
Hmm.
within those 24 hours.
Mm.
So but what I didn't realize, even though it was great in that I got a lot of freedom, I had a lot of freedom. I started to consult and do a whole bunch of other things with my medical degree because I had the freedom to do that.
Right.
But what came with it and what I realized as I was in the thick of trying to conceive was that I was chronically fatigued.
Right, exactly. Because these 24-hour shifts are throwing off your biological clock,
It,
and you
yes.
can't, it's not even that 24-hour shift of being awake that long. It's like even a little sleep deprivation impacts 2 days later. So if
Yes.
you're up for 24 hours under this constant stress, this fight or flight, your body is almost doesn't know how to come out of this
Yes.
sympathetic nervous system.
Yeah. So Carly, so what ended up happening is
Mm.
I worked as an OBGYN hospitalist for close to a decade. And what I
Wow.
realized, like when I was trying to get pregnant with Caleb, was that it was harder for me to recover from a 24-hour call
Right.
than what it was 5 years ago. It
Right.
took me like 2 or 3 days to recover, whereas 5 years before I could do like every other day call. So I would do 24 hours on Monday, get home Tuesday morning, be off, and then back again Wednesday.
Wednesday.
And I'd be
Wow.
good. But as I got older, and during that time, when
Yeah.
I got older, was when I decided, okay, I want to be a mom now.
Hmm.
My body wasn't the same. It was
No.
chronic stress for many years, right? And now I can't even recover after a 24-hour call the same way. And then there was other signs and indicators. My blood pressure was going up.
Hmm.
Even though I was chronically stressed, I was having a hard time sleeping.
Mm.
Um, I was grouchy.
Yeah.
And this is even before I started on the hormones with IVF and so forth. And by the way, it was 16 cycles.
16, not 14. Whoa. Okay.
Yeah, 16 cycles. And we'll get into that. But
Yeah.
yeah, and so and my whole story is a testament, I think, Carly, to exactly what I said when I began this conversation with you, is that you cannot have it all. And
Hmm.
you have to make sacrifices or start to think strategically
Hmm.
if you have a certain goal in mind, and that goal is so important to you on your life journey, then you
Hmm.
have to figure out a way to make that happen. And so I started to try to get pregnant while I was still an OBGYN hospitalist, still doing those 24-hour calls. Now at this point, it's taking 3 days to recover from a 24-hour shift and then having to go back again. So sometimes
Right.
I wouldn't have 3 days off. And so it
Yeah.
was just compounding stress and tiredness and fatigue and compounding. And then I had the audacity to try to put my body through
Pregnancy.
the first through, yeah, to try to conceive, right?
So
And I was
Renee,
kind
can
of
I ask
like
you,
older.
yeah,
Yeah,
during this time through like and I want to like zoom out so people can really get a chance to like not just hear your story but kind of like plug and place yourself in Renee's shoes, because if you're going through IVF or you're trying to conceive and it's not working, there are little tidbits in this story here for you to like
absolutely.
kind of zoom out and be like, oh shit, am I doing that? Right. Like, and the
Absolutely.
part that like you're able to show and portray is the level of stress that you're under actually in this life, the sleep deprivation, the
Yeah,
signs and symptoms that we're kind of building. And so you're recognizing that like with the mood disturbances and with this recovery period, you're not bouncing back anymore. You're not in your 20s. It actually is a compounding interest. So you
yes.
started to recognize and feel that. Did you notice when you were trying this and starting to think about conceiving and or through that whole journey, how were your menstrual cycles? Were you ovulating
So,
regularly? Did you check your cervical mucus? Tell me about like what you recognize with your menstrual cycle yourself.
right. So you have to realize that I started my journey to be a mom older. So I
Mhm.
was, because I actually ended up delivering Caleb when I was 47, and
Hmm.
we went through 4 years of IVF.
Yeah.
We had tried, I didn't try for 6 months or even a year because I was a physician, so I used to counsel this with my
Yeah.
patients. I knew that at that age, like it was, I tried for a few months naturally and it wasn't working. Now, my periods were normal. Um,
Regular length,
they were regular.
regular flow,
Yeah, regular flow. Well,
regular, like, could you recognize, did you ever use the fertility awareness method, like tracking your temps? Could you
yeah,
confirm ovulation?
yeah, I could confirm it, and I knew ovulation. Like, I didn't really. I'll be very honest. I never
Yeah.
did BBT, but I did do the cervical mucus test, and I
Okay.
was using ovulation predictor prediction
Hits.
kits.
Okay. So you
And
never
so
checked. Mm.
I never tracked my temperature,
That's
but I
interesting.
was so right. It is a thing. In hindsight, I should have, but
Yeah.
I was so in tune with when I was ovulating because I really knew, like I could
You could
tell.
feel it with your signs and
I
symptoms.
could feel it. I
Yeah.
the cervical mucus changed.
It was perfect. So
I
you could like remove it. You removed it from your like, and you could feel the
yes.
difference and it would sink. And so you knew it was ovulation.
Girl. Yes,
Okay.
I knew it was ovulation, and then the ovulation prediction kicks
Yeah.
confirmed that yes,
The LH
um,
surge.
LH search. So
Okay.
that's one of the reasons why I never did the basal body temperature because I was so good at the signs of my body and then using that kit. But I was older trying this, and
Right.
so we tried it for 3 months, and that was the time frame I gave myself because I knew that the clock was ticking for me.
Hmm.
And I said to Omar, he's my partner, he's the father of my son, Caleb.
Hmm.
I was like, okay, it's time. And I knew that I already had my eggs. I think that those eggs were from when I was maybe about 34
Hmm.
is when, maybe 34, 35 is when I froze those eggs. So those eggs were not the ideal eggs because I waited too long. And that's why I was
Mm.
saying if I had thought about this before and had this counseling before, I would have done things earlier. And so we moved on to IVF after 3 months.
Hmm.
And then that's what started the 4 year journey. And it was 4 years straight
Or you're
of
straight. So 4 rounds every year for 4 years, which got you to your 16th. And your 16th
yes,
one
girl.
was a viable pregnancy. This is Caleb now.
My seventh transfer, because what we would do is we try to bank the embryos,
Mhm.
right? The eggs, I'd get as many eggs as well. And there were some cycles that were not successful, were not good. And some I got a lot of eggs and some I got a little bit. And so we would just keep going, right? And try to bank those embryos. And then when we found that it was the time to do it, we would try to do a transfer. It would be a frozen transfer. Now, Caleb's wasn't though. His was a fresh transfer. We decided to change things up because we had 6 months before that decided to really focus on our nutrition.
Hmm.
And we did some changes with our nutrition, which is what led to where we are at now with regards to trying to help others. But we did some real changes with our nutrition, and I should say that my partner Omar, his name is actually Chef Omar Powell.
Hmm.
He is a classically trained French chef. And so combined with his knowledge of food and food pairing and combination. And me as a physician, now I'm not a nutritionist.
Right.
We get very little nutrition training in medical school, but
Right.
I'm smart.
Yeah.
And
You
started
research.
I did research. And
Yeah.
so the little that I knew from medical school and residency, what we were taught with
Yeah.
regards to nutrition, I combined that with just pulling all the papers and
Hmm.
seeing, the medical research, what's out there. What is it that we need to be focusing on?
Hmm.
What can help like someone who has chronic stress, and what impact does chronic stress have on your body? How does that portray itself on the cellular level? Like I started
Hmm.
to do that sort of research.
Yeah.
And then how can I empower myself for whatever damage that I have done through the course of my life with the work that I was doing, with the stress that I was under, with the fatigue? How
Hmm.
can I kind of reverse that through lifestyle changes? And so
Hmm.
we really start to focus on that the last 6 months by changing our diet, changing our lifestyle. And I really do feel that um, it helped us not have to do a 17th cycle.
So
I'm so
I really appreciate that because I'm a total nerd. And, there's a point in my career where I decided to go back for more school or stay in my wheelhouse as being a functional nutrition coach and personal trainer. And the medical world with all the drugs and stuff, it didn't resonate in my body. I didn't like it. I was like, I want people to do natural things, like go play in the grass. Like, I don't want them to take drugs. I want them to find it through nature and decreasing
Yes.
stress and doing things that like increase play. And, this level that isn't necessarily even, it's like that combination of the holistic approach. It's actually like you're a whole being, right? You're not just a test lab. We're not just blood work. And so, I
So,
really,
Carly, it's really important. I'm going to tell you this. I'm going to be very honest with you. For
yes.
some women, they do need the science.
Yeah. Yeah.
Okay.
Oh, for sure.
And I needed the science. I
Yes.
needed it. Okay. I needed the help. But that does not mean that the holistic approach did not
To throw it out.
optimize everything and
Right.
shorten it. It
Yes.
certainly did. And on top of that, it gave me a sense of empowerment that the science took away from me. And I
Yes.
am a physician, so I understood every step of the journey. Each of those 16 cycles, I knew exactly why everything was happening. And so I
Right.
had more insight than the typical IVF patient, right?
Right.
Because
Yeah.
even though I'm not an REI, like a reproductive endocrinologist and infertility specialist, I didn't do the extra 3 to 4 years training. I did in my residency and medical school, we did rotations in that subspecialty.
Right.
And I knew like I just was smart and I did the research both as a physician and as a patient. So I
Mm-hmm.
understood what was going on.
Yeah.
Science, when you have, and so some women needed it, I needed
Yeah.
it,
Right.
but I also should have implemented what I did the last 6 months sooner because
Yeah.
no one can tell me that it would not have saved me money, saved me time, saved me tears,
Heartache.
heartache,
Yes. So
anguish if I
that's
had
I'm
implemented that
wondering,
holistic approach.
before that 16th round, you had never thought to add in these components. So this was literally the turning point where you're like, let's do the nutrition, let's do the decrease in stress,
I
let's
never
change around
thought.
the lifestyle. So you never thought of it before
I
then.
mean, we didn't eat crap. I mean, I have a chef as a
Right.
partner, so
Right.
the food was always delicious. But for us to
Right.
really focus on, okay, let's do some food pairing, or let's make sure that we're eating certain numbers of certain types of foods during, because now I'm trying to get my eggs to grow.
Yeah.
So what foods can help me
Mm.
that stage or that cycle,
I
right?
see. Yes.
Um,
Yes.
I was really getting down to that sort of where are we in the cycle
Mhm.
of what we're doing and what foods and lifestyle changes, okay, also
Yeah.
including sleeping,
Yes.
meditating,
Yes.
decreasing stress, all of that. It wasn't just about food,
Right.
moving your body,
Yes.
all of that stuff. What can we be doing at certain stages of this IVF cycle to optimize and increase my
The
odds
chances.
of
Yes.
being successful?
Okay, so
So,
beautiful. So this is so good. I love this.
uh,
So like optimizing it, you had this insight, let's do everything to optimize the chances. So this means that during this part of your menstrual cycle, during this part where you're getting this estrogen, where you're getting extra progesterone, you are actually eating the right foods to support the luteal phase.
uh,
So now we're actually going to bring in extra magnesium. We're actually going
yeah,
to bring in these
helium for him. Like,
selenium. Yes,
he
like bring in
even
Brazil
started to
nuts.
eat, yes,
Right,
because
exactly.
remember, it takes two, right? So he had to
Yes.
give the sperm cycle. So a
Yeah.
sample. So we needed to optimize the sperm sample that we'd be using for the next IVF cycle, right?
Yes.
So we both were on this journey together, and it just
Right.
so happened that we were able to do it with delicious food
That's
because
amazing.
chef.
Yeah. Well, and
So
it's interesting because I am glad for Omar and I'm glad for you in sharing your story because there is so much pressure put on the woman when it comes to infertility. And
yes,
I know that in the women that I support who are on this journey that took them longer than what they were expecting or planning, right, of fertility, it's like they have only taken on the weight themselves. And what you're saying is so true. Like the male sperm, the male's more physiology, the male's motility is so imperative. The DNA that he is sending through the
Very
sperm
important.
impacts 3 months in advance what he is eating, just like for the woman, is
Woman, her
impacting
egg.
the
Yep.
future baby, right? Exactly. The sperm and the egg. So,
So we were doing it together,
right.
right? Because
Yes.
we wanted to increase our chances exponentially. And
Hmm.
so it wouldn't have worked if it was just me doing it and him not, right?
Right,
So we
right.
did it together and we researched it together. Honestly, I know that those 6 months was crucial in that it allowed us to not have to do a 17th cycle,
Yeah.
and we were able to do a fresh embryo transfer, and Caleb, that transfer was the seventh, and we got pregnant with Caleb.
That's amazing. How beautiful. That is so
So
beautiful. And he's like your little star seed. Like, what a
he
blessing.
is
Oh my gosh. You
is
know what, too?
everything wrapped up into it. He is all our love, our hopes, our dreams, everything wrapped up into one. Those 4 years of hell, just hearing him laugh or kissing his fingers or his toes made
Hmm.
all of that worth it. And because that was always what I always wanted to be a mom,
Yes.
right? I
Yes.
always wanted to be. And some women, it's not their journey. And
Yeah.
if that's you, that's fine.
Yes.
Don't let
And I'm glad
anyone
you brought that up because I
yeah,
actually wanted to ask you, and I deal a lot with like the psychological component of how we
yes.
manifest diseases and or instances in our life. And so I wanted to ask you, was there a part of you that when you started trying naturally, like can you go to this part in your brain where you still weren't bought in yet? And or thank you for being open to and analyzing yourself like this. Is there a part in your journey that maybe even when you started trying with IVF that you weren't quite sure that you still wanted to be a mom, but then maybe the bridging of you and Omar coming together and making this plan where you guys were really together that made you feel really safe in the relationship that allowed you the chance to conceive? Do you feel there was a psychological piece to this at all for you?
There was a psychological piece. There was never a time that I didn't want to become a mom, but
Yes.
there was a psychological piece in that I didn't trust my body. I
Mm.
honestly, I feel like looking back, I had too much knowledge as a physician,
I
right? So I was
see.
always relying on what my training and my medical knowledge and really buying into the fact that I was an older trying to do this. I was over 35
Ah,
and I was trying to
yes,
attempt this and buying into all of that, women over 35, basically you're
yes.
considered,
At risk,
I think they
geriatric.
call it
Is
geriatric
it geriatric pregnancy?
periodontal,
Yes.
advanced maternal age, AMA. I
Yes.
bought into all of that. I mean, I
Wow.
really did. And so maybe in hindsight, if I'm going to be completely transparent with you,
Yeah.
I could have tried longer naturally.
Hmm.
Whether or not I would have been successful, who knows?
Well,
Um,
with that mindset, maybe not. You know,
Probably not.
right.
But I did try. And
Hmm.
then I immediately felt that IVF would give me better odds just because of where I was starting, the age that I was starting at.
Hmm.
And so I bought into that.
I really appreciate you saying that in that level of honesty because I know seeing miracle stories of people healing themselves from all kinds of crazy ass diseases where doctors don't understand what's going on, and I start working with them and we start tapping, we start going into childhood memories, and or what are we telling ourselves? If we're
Mhm.
telling ourselves I can't conceive, I'm infertile, I'm old, I'm a geriatric pregnancy, I know the risks, and you're going through risk, we know that even having those thoughts are sending the alarm bells off for stress.
Absolutely.
And that stress
Absolutely.
actually, we can't create. We're not digesting food during that time. Our alarms are on that this is not the chance of relaxation, of creation, of reproduction. Hell no. There's no
But
space for that right now. But if you really felt like, Renee, it's okay you're 35. It's okay you're 42 and trying to start your family right now. It's okay. You know this path is for you. You're safe. Just lean into your body, learn how to trust it, feel into it. And if you were in that surrender place, who knows?
who knows? And I'm going to be very honest with you.
Yeah, please.
Starting at that age, which was 42, you did the math.
42. Yeah.
The chances just biologically because of the egg, how
Yeah.
many eggs you have left, the egg quality,
Hmm.
chances are much lower than if I was 32. Okay, let's
Right,
just be
right. That's just,
okay.
yes, yes.
But that doesn't mean
You
that you can't
can't
get
conceive.
pregnant. Right.
Right. Thank you.
It
Thank
does
you.
not mean that you can't.
Yes.
It's
Yes.
just that you have to have the right mindset and you have to also understand the challenges that you're dealing with. You're dealing with an older body,
Right.
eggs that have less eggs,
Right.
less not as good egg quality,
Right.
but you can do what you need to do, optimize to optimize your body.
Hmm.
Um, and I'm just kind of lost this train of thought.
I got you. So we were talking about your egg quality and how just because you're older doesn't mean you can't conceive. And
Right.
we were talking about how if you were to still, you're not 32, there is a difference in your egg quality and quantity, but it doesn't
Yeah.
mean that you can't conceive. And
Right. It does
so,
not mean that it's 100% over, that it's
right,
impossible. It's not
right.
impossible. It's just that the odds are a lot lower.
Mhm.
And then what you need to do is make sure that you're dedicating to optimize your body, which is what I was going to say. And what does that look like? So, how are you going to be able to optimize your body? You're going to have to optimize it through lifestyle changes and nutrition changes.
Mhm.
When you do it that way, it will, you will strengthen your body, decrease inflammation,
Mhm.
decrease stress, get
Yes.
more rest, move yourself more. So your cardiovascular system, blood flow, you're
Yes.
going to be in a better physical state in order to conceive and support that pregnancy. So you are going to increase your chances by
Mhm.
doing that, but you have to be realistic.
Yeah.
You have to be realistic and know that there are some odds that are working against you. But by
Yes.
all means, I think that everyone should try to optimize themselves holistically. Whether or
Yes.
not you need science,
Yes. Right.
you also need the holistic approach.
Yeah. I appreciate
Right?
that.
Yeah.
Renee, would you feel comfortable because I'm a nerd and I want to know like the steps you've gone through. And so I'm going to ask you like
Sure.
different questions about how you optimize these different areas of your life. And so how during your time of optimizing exercise, for example, during this kind of like 6 month time and doing a live transfer, was this something that you added in like the whole components of exercise where you did strength training, you did cardiovascular health, you did rejuvenation exercises like Tai Chi, yoga? Were you doing any type of cycling with your menstrual cycle? So making sure that during the time of menstruation, you are really in like relaxation and rehabilitation. And then follicular phase, you were increasing cardiovascular activity. And during ovulation time, you did a little bit more strength stuff. Were you following any kind of
I
cycle?
was.
You're okay. Yeah. Would you
I
please?
was. But remember, I was also doing IVF. And
Right.
so for those who have done IVF or understand it, then you know that there's a certain amount of time with the injections that you're trying to get your eggs to get as many eggs as possible for your egg retrieval, right?
Yeah.
So as it gets closer and closer to your time, your ovaries are going to be more larger and larger packed with those eggs, right?
Molecule. Yes.
So I would still be doing activities, but as my eggs and as my pelvis was feeling heavier, it
Hmm.
wouldn't be as strenuous. So
Okay.
I would kind of do more relaxing, moderate, light exercises, but still moving your body. So
Okay.
that's how I kind of switched up the exercises for the different phases
Yeah.
of I because I wasn't doing it naturally then. And so I had
Right.
to go along with what was happening with me for the science to get me pregnant. But that doesn't mean that you can't do that. I'm a testament that you can change things up and do it on in a secular format, even if you're doing IVF, and certainly if you're doing it naturally, of
Okay,
course.
beautiful. So, like, instead of it being cycle syncing, it was
Yes.
more synced up with the IVF protocol of your injections and also optimizing
And
egg quality. So,
yes.
yeah,
And
so we're thinking like instead follicular phase, this is the time to optimize cardiovascular activity and pick up some strength training, but you're going to actually decrease then because
yes,
okay, so we're thinking about like
because Right, because remember, when you're doing it naturally, it's
Yeah.
really one, maybe two eggs that are going to be released during that cycle, right?
Yes. Yes.
That's not the same for IVF. For IVF, you are trying to get as many as you can when it comes to the time for egg retrieval. And that's the whole
Uh,
difference is that you're trying to get as many eggs to be retrieved so you
yeah.
have many chances to get pregnant
So
with whatever embryos or whatever eggs are able to be fertilized.
So how is that happen there? Are they increasing the I'm just getting to some nerdy stuff. Are they increasing follicle stimulating hormone? Like how is it not because one egg is on the race, right? To
Yeah,
become the biggest and
right.
then they typically dissipate, but are they giving you extra hormones so that way
Yes,
these other ones
they're
don't
giving you FSH, but they're giving
Yes.
you a form that your body will accept and be able to process in
Okay.
order to make FSH do what FSH is supposed to do in your body. But
Okay.
simplify it because in a natural cycle, that
Yeah.
FSH and the whole cycle with the
Oh,
FSH being released and causing the ovary, the estrogen and so forth to
yes.
get higher and for you to be able to get that
Release
one
the
follicle to really grow and then to be released. And then
right.
after that, you have the progesterone and all that.
Hmm.
You're just amplifying that to the nth degree because you don't want just one, you want as many as you can. And so
Okay.
that's where the injections come in.
I
Those injections, and you're on a schedule and a cycle as
yes.
to when you're supposed to be doing the injections and how much of
Hmm.
that dosage that you're getting. And that's all determined by your doctor, who's determining that by your labs and how your body is looking. You're going in, you're getting ultrasounds and so forth. They're seeing where you at this stage of the follicular phase of the IVF cycle. What does
Right.
that look like on the ultrasound? What are your follicles looking like? Then a couple days later, after you still doing the injections, they may
Yes.
increase the injection dose or whatever if it's not
Mhm.
looking the way that they want it to look, and then they have you come in a few days later and see, okay, are you responding? So
I
that's a
see.
big difference. So
Yeah.
that's why, as you get to the point, if that cycle is successful, because sometimes they have to cancel the IVF cycle. Sometimes, even though you're injecting the FSH, your body's just not responding. So where you should be at a certain point in that whole process,
Hmm.
when you're looking in the ultrasound, it's not what the studies have shown it should be looking like. You may have to
Be
your
done
are
with
your
the injections.
they may cancel it. They may just say
Okay.
this is not a good cycle. We're not going to get anything. We're going to have to just cancel this cycle. So, but you don't want to hear that, right? You
Right,
really
right. No, because you don't want to
right.
slow down the
You don't
progress.
want to go down. So you
Yes.
really do want it so that your body is responding.
Yes.
And when it's responding, that means your ovaries are getting bigger and
Hmm.
bigger. More eggs are being recruited and
Yes.
recruited. And they're getting bigger and bigger. And you just feel bloated and full down there. That's why, as it gets closer to the retrieval date, you really should be doing more light. And that
Yes.
it also increases your chance of an ovarian torsion if you're doing too much too crazy,
Right.
right?
Okay. So I see. They
Yeah.
thank you for clarifying that because me not going through it personally, I don't know, but like also knowing, okay, well, this is how the normal cycle works. So I see. So instead of these in a typical pregnancy, what usually happens is FSH is released from the brain and it's telling our body to actually grow these eggs. And so we have multiple eggs that this happens every menstrual cycle. And usually there's one egg that wins the race, one or two eggs, right? And so they grow bigger, bigger, and bigger. So with IVF, we're trying to do this for multiple eggs. So when we retrieve the eggs, we have more of a pool to try to fertilize. So when we
Yes.
put them back in you, there's a higher chance of any of them even taking.
Yes, because this whole process, and this is the reason why I became an OBGYN to begin with,
Hmm.
this whole thing, whether it be natural
Hmm.
or science, is really truly a miracle.
It
It
really
really
is beautiful. Yeah.
it's beautiful, but it really is a miracle.
Yeah.
Like there's a lot of things going against having a successful pregnancy, whether it be
Our
natural,
cervical mucus, like literally the fact that women really only ovulate
so
one
many
day
things.
a month. It's a big deal. It really is.
Huge deal. So like even so the reason why they're stimulating you so much to get as many eggs as possible is because they know that once they do get those eggs, a certain number of those eggs are not going to be usable.
Right.
And then even the ones that are usable and are able to be fertilized, a certain number of those eggs are not going to be get to the stage of fertilization that you need
Right.
to either put it back into you right away as a fresh transfer
Hmm.
or to freeze. So you
Hmm.
know that it's like every stage you go, it's less and less chance. That's why I say it's like completely a beautiful process. And when you're doing it naturally, it's the same thing.
Yeah.
There's once that egg is released, there is odds that the sperm will not be able
Reach
to
with,
reach it.
yeah,
Or if it
exactly.
does, it may implant where it's not supposed to implant. Okay, that's
Yes.
I come in as an OB and I've taken surgically helped a lot of ectopic pregnancies
Mm.
because those embryos have fertilized outside
Oh,
of the uterus, like
yes.
they fertilize either into the abdomen or in the fallopian tube. So
Hmm.
that's why I'm saying just knowing the science, every birth is such a miracle because there's so many things going against
Hmm.
that to
Natural
be
process.
successful.
Yeah.
Yeah.
And that's something I say to people. I'm like, you feel insignificant in this world. Let me tell you how
God,
significant you are. Just for you being here on this planet,
you are a miracle.
there are billions of sperm that exist every time a man ejaculates. Let me just say it how it is. And for
Yep.
us women, we have a million at birth, and then it starts to slowly dissipate, and this wanders off. So you take a billion and a million, and that's every time by chance that he ejaculates, right? And
Yep.
you're one of those billions of the a million times he's done that, right?
Yep.
And then for the women to be releasing these eggs, the fact that when these all these parts come together and you were the one to make it, you're like, talk about survival of the fittest, man,
are
right?
you
Like,
are a miracle. And
you are
that's what I always felt. I felt that pregnancy was the most miraculous state.
Mm,
And as women to be able to experience that was
yeah,
just like there's a little piece of you're experiencing a little piece of like the
heaven.
universe in
Yes.
you,
Yeah,
you know? It's
it
just,
is really.
I so desperately wanted to experience that. It got to a
Mm,
point when we started this conversation, you were talking about all the OBGYNs that were helping you through your pregnancy, but they didn't experience it themselves. I was one of those OBGYNs, and it got to a point where it was killing me
oh,
to still like to be given care, knowing so desperately that I wanted to also be a mom, but it wasn't happening for me. It
oh.
was a complete mindset thing that mindset was really the thing that was the hardest, even
Hmm.
though physically everything I went through, not even just the back-to-back hormone injections, the egg retrievals and all that, my body kind of repelled to all of that stimulation. I actually had to have multiple surgeries during those 4 years because my uterus grew to the like a 28-week size, which is
Oh, that's.
just a little under 8 months of
Hmm.
a thigh. Just think of an 8-month pregnant woman,
And that
full
uterus
of
is.
full
Mm,
of fibroids.
Jesus.
And I had to, because of the hormone stimulation, the back to back, and I had to get my uterus completely reconstructed.
Did you ever
So
have cystic fibroids before the injections? Was
I
that
had
your?
one 2.5 centimeter fibroid. And you know all this when you're an IVF patient because you have to get ultrasounds. They have to see what they're dealing with before they start like kind
Mhm.
of like effing with it.
Yeah,
So
right, right.
know, you have to see what the baseline is. So I knew that I had one, but girl, after all those years, I think it was like 2.5 years in, I had to get it was a 5.5 hour surgery. I was in the hospital for a week. I got over 6 pints of blood for transfusion because what they did was they had to take my 28-week size uterus, which is probably around this,
Yes. Yeah.
and shut it down. And
So they.
how they shut it down is by pouring out fibroid after fibroid after fibroid and then sewing up that uterus.
Whoa.
Caleb is a complete miracle because honestly, um, I'm going to tell you honestly, I had one of my attending physicians who trained me as a resident years before. That's who ended up doing my surgery. I had gone to another OBGYN who didn't train me, so they didn't have kind of like a connection. And
Right.
they told me that I was crazy. Because remember, I was 42 when I
Yeah.
started this. But now I'm like 44.
Yeah.
And they're like, you need a hysterectomy. What are you talking about? You want a my
Right.
it's called a myomectomy when they take out the myomas or fibroids
Yes.
out of your uterus. But they're like, are you crazy? Your uterus is so huge. You have so many fibroids. It's a risky surgery to begin with. And you are doing this at the age of 44 because you think that you can get pregnant. I actually had an OBGYN tell me this. And
Yes.
I'm like, and they're
I'm gonna
like,
do it.
well, I'm not going to do it. And I'm like, that's fine. So then I went and I found someone who trained me. She's
Yes.
an REI, but she's a reproductive endocrinologist, infertility specialist, but she doesn't do IVF cycles. She just more focuses on the surgery.
Mm-hmm.
So it's more like uterine sparing, uterine surgery in order to allow a woman to still be able to carry a baby. That was her expertise.
Mm-hmm.
And she told me, yeah, it's going to be difficult, but we're gonna try. So she had to do it 2 times. So she tried once laparoscopically, but my uterus, the way how we assessed it on ultrasound and when she actually went in live, when I was in the OR, the uterus was so high up, going up into my diaphragm, that she couldn't get proper visualization. She
Mm.
had me on the table for 2 hours. The anesthesiologist had to put me in a deep Trendelenburg. It's like a position
Where
where
you're going against gravity.
yeah,
Yeah.
yeah, in order to try to get the bowel away,
Yeah.
right, from
Yeah.
where she needed to operate. And it's still basically it couldn't be done laparoscopically. She tried her hardest and she had to close me up. And then 6 months later is when we went back in, but this time, and remember, it grew within that time. This time
Yeah.
we had to do it open. So I ended up having like a C-section scar.
Yes.
That was the surgery, the 5.5 hour surgery, the 1 week in the hospital. And that's when she was able to shrink it all the way down by
Wow.
taking one fibroid at a time. And with every fibroid, and remember, fibroids, for them to grow, that means they have a huge amount of blood supply going to them. So it's a
Yes.
very bloody surgery. That's why that one doctor
Said
laughed in my
no.
face
Yeah.
and told me, girl, you just need a hysterectomy. What are you talking about? Like, seriously. Um, but
Oh,
she took a chance on me, and I thank her every day because she's the only reason why I was able to carry Caleb, and I
oh
carried him
gosh.
myself.
Wow.
I just
Wow.
couldn't have him vaginally. And the reason why is there was too many small scars on
On the
my
inside of
at
your uterine
different
lining.
angle, inside, outside. Just think of it. Just think that it was basically patchwork. And
Right, right.
I have all the pictures. I think she
Wow.
took out like 14 or 16 fibroids. She lined them all up. But when you think about that, when it healed, it's like just crisscross all these different scars on your uterus,
Yes.
which when you are then in the throes of labor,
Labor. Yes.
it's not just one, because for women who've had C-sections, the
Yes.
reason why we're so afraid of them having a vaginal birth after, and it's just one incision that we're talking about, is
Right.
because there's a chance of rupture,
Yep,
right?
exactly. Yep.
Now, when you add 16 incisions at least, girl,
Oh
please.
my gosh.
Yeah,
I
so
have chills in my whole body.
I could not, so I had to have him um via
Cesarean.
C-section. But that's fine because you know what? I got to carry my baby.
Yeah, yeah.
I got to experience everything that I had wanted to experience so desperately, and all the stages that I had guided women through clinically, so many years of my clinical practice, I got to now be the one
Mm,
experiencing
mm.
that. And that was a miracle for me.
Wow.
Mhm.
I'm crying. Thank you.
Miracle for me. So, having said all that, I think and I think the reason why we connected, Carly, is that we're both on the same page,
Mhm.
that the holistic health is really the foundation of everything. Whether or not it's you're only going to do it naturally, or you know that you need the helps
Yes.
scientifically,
Yes.
you still cannot cut out everything
Yes.
that you're going to get, all the benefits from the holistic approach, that being nutrition,
Yes.
that being your mindset,
Yes.
that being proper sleep,
Yes.
that being movement, moving your
Exercise.
body.
Yes.
All of those
Yes.
help in so many different ways, not
Stress
just
reduction.
optimize your body for
Yes.
conception and pregnancy, but
Oh.
also just to give you empowerment,
Mm.
Carly. For
Hmm.
someone who went through this for 4 years, I felt so unempowered. Like I felt powerless. I felt worthless. I felt it was the darkest period of my life. I questioned everything. I questioned why I was placed on this earth as a woman. I
Hmm.
felt like I was of no use to anyone. I actually said those words. I said it to Omar. I told him to leave me,
Oh,
that I'm not like I can't even do the basic thing that a woman is supposed to do. Like I went deep. Like you go deep in this. Like it shakes you to your core.
yeah.
But when you are starting to do things and actions and you're learning things and you're learning skills and you're changing habits and you're doing things step by step and you know that you're healthier because of the actions you took today than you were last week, that is so empowering. And
Yes.
even and even though it doesn't guarantee
Yes.
that you're going to have the baby, it
Hmm.
does guarantee one that your mindset is different, and
Yes.
having power and feeling powerful is a miracle in and of itself. And you can achieve anything doing that. Like you can
Right.
push through anything. And that in and of itself is invaluable. But on top of that, there's no way that you're not going to be healthier because you're going to decrease your inflammation. You're going to
Yeah.
be more rested. You're going to be eating balanced and well. You cannot tell me that you're not going to be healthier. And then you can't tell me that that healthier state is not going to be a better chance of you getting pregnant than when you were not healthy.
Yeah.
No one can tell me that.
Yeah.
So,
Right.
yeah, so either way, you are gaining the benefits, whether you need to use science or not,
Yeah.
by having a holistic approach.
And it's like, what is the worst case scenario? You feel better? What is it? You're more rested. And the
Exactly.
worst case scenario is you don't get pregnant, but guess what? You now are more healthy, you now are more balanced, you now have
Exactly.
these skills. So I really appreciate that. My gosh, your story is so incredible. And like just to go that deep of like how a woman can feel in those places is, I know, going to speak true to so many women who are also struggling with these thoughts, and also that me too. Like I didn't even know why I'm questioning my womanhood because I thought I was infertile, or I wasn't giving my husband this child, and then you have a son too. So like, oh my God, that's so
it
beautiful.
it rips you apart, Carly. And so if
Ah,
there's any way that we can help, because I know
yeah,
that we approach this differently,
yeah.
but either way, the foundation is still to help women holistically be
Hmm.
able to conceive and have their
Yes,
child. So, if we
yes,
can get a woman out of that state that rips you apart,
yeah.
and so many women are still stuck in that state,
Yes.
Carly,
And it's like one step forward. Like,
one
so
step.
one step forward, one step forward, one step forward. And we know that if you are taking a step forward, you're moving out of this
That's
hopelessness
right.
and depression and stuckness. And you're moving into that, like what you're saying, embodied,
Yes.
empowered. And
Yes.
this will alone bring you to higher places. Like it's just literally increasing your vibration, decreases your chance of injury, chronic diseases, other things that come along with that, like extreme stress, like that weight you are carrying is like lifted from you when you start to do something for yourself. You start that empowerment is like you're lifting your vibration and your energy levels.
Are. You
And
are.
so we talked about briefly your exercise, how you match that up with your IVF cycle. What did you do different for your sleep? Did you start to like really focus on 7 to 9 hours of sleep? Were you consistent with your
Yeah.
sleep schedule? Did you really like hone in and care about having that consistency Monday through Sunday? And like, did you get all nerdy with your sleep? Like, I'm establishing a nighttime routine. I'm making sure that I have quality REM sleep, quality, like you really got into it with your sleep?
Harley, I did a complete overhaul. So 2 years into that 4 year journey, that's why I know I stopped practicing,
Yeah.
because it was impacting my path to motherhood. It
Mm,
really, truly was. There was no other way for me to get around having to do 24-hour shifts.
right.
And that I just told you that my body, how I responded, the recovery time was, it was getting longer and longer for me to recover, but
Yeah.
yet I still had to go back to work. So now I'm going back to work still fatigued.
Yes.
And then I'm trying to go through IVF cycles. It was a horrible combination. It
Mhm.
truly, truly was. And so it comes full circle back to what I said, that as a woman, I am sorry, you cannot have it all. I
Yeah.
am sorry.
Yeah.
Whoever told you that, they
Yeah.
lied to you.
Yeah.
You need to be enlightened. You need to be knowledgeable and understand yourself, understand what goal you want to get to, and understand that there's certain sacrifices and steps that you need to put in place in
Yeah.
order to get to that goal. And for me, what that looked like is understanding that even though I worked almost half of my adult life at that point to become a physician, what was more important to me at that stage of my life was to become a mother. And
Yeah.
I needed to figure out a way how to be able to achieve that.
Yeah.
And for me, not practicing was crucial to that. So
Yes.
I transitioned to become a physician executive. So I stopped practicing in 2019.
Hmm.
And this was about 2 years in to
Hmm.
my whole 4 year journey. And I
Right.
ended up having Caleb. I got pregnant with him the next year.
At 46. Wow.
Next
That's
year.
amazing.
And
As
remember,
soon as your body was allowed to rest consistently. And I don't feel like people really understand the dynamics of what's going on in your body with your hormones when we sleep. Like, it's not
yes,
just like a hoaxy thing, like, get good sleep. Like your mother
it
said,
was
go
huge.
to bed on time. It's huge for all of your hormones resetting the nervous system. And 5 hours is not enough sleep.
It's not enough sleep. And I would get, so it was huge. It was such a lifestyle change for me to go from being a practicing OBGYN to now a physician executive where I'm working kind of like a 9 to 5. I
Yes.
had weekends off, I had holidays off. I was in my bed every night, as opposed to what my life was before, where I was working every third or fourth night in the hospital. I would be doing emergent surgery at 3 o'clock in the morning. And maybe after that, I would be able to get maybe 45 minutes rest before I'm paged again. Or if I'm lucky, or sometimes I'd go the whole 24-hour shift and not rest. And
Right.
so it was a huge difference sleeping in my bed every night, knowing that and yes, did I make sure that I was getting those hours in? Oh,
Mhm.
yeah.
Yeah. Good
I
girl.
was going to bed sometimes at 8 o'clock, 9 o'clock. I was
Yes.
getting rest in.
Good girl. That's amazing. Well,
Yes.
I'm glad to hear you say, because I know that like sometimes when I start working with people and I go, okay, well, the first thing that we need to do to have you like start to establish your pregnancy, and getting you on is you need to quit your job.
Yes.
And like,
Yeah.
I am not coming from a place of kidding. I'm coming from the place of the reality of how these swing shifts or how the whatever it is, this work that is so taxing on the body that isn't allowing it its normal time to rest and recover. There is no way. There is no way that we can have pretend fake hope. But like what you said is so important is you decided you wanted this more. So you were willing to change or let go of this dream.
It looked differently
Yeah,
for me.
make it
And
look
that
different.
it had to, so you have to decide if it comes to a point where your job is impeding your goal of being a
Mhm.
mom.
Yeah.
And this job really is, it's if you are working for someone else, it's a job,
Yeah.
okay? And you can lose that job tomorrow. It's a
Yeah.
job.
Yes.
Being a mom is a lifetime journey that
Yeah.
it supersedes you.
Yeah.
It's a legacy. Do you get
Yes.
what I'm saying? So you have to put it in perspective. And
Yeah.
if it means that you have to have a different job, or your job, how you're bringing income in for your home looks different
Hmm.
for you to be a mom, then you have to effing do that.
Yes. Yes. Right. Right.
And that's what I did. I had a
Oh,
real conversation with myself, real understanding of where I was age-wise, where I was body-wise, like
yeah.
health right then as I was practicing, how I was feeling, my blood pressure going up, me
Yeah.
getting very little sleep,
Yes.
having to call every 3 to 4 nights, me trying to get through these infertility treatments in the
Mhm.
midst of all doing this. I knew that it wasn't, those two they didn't
No,
go together.
they're not, and they're not in alignment. And that's
They're
sometimes
not.
people don't realize that, although they're saying one thing, I want to be a mom. It's like, okay, have you changed this? Have you started to address the factors of stress in your life? Have you started to address your nutrition? Then you're not ready yet. That pain point
Not
hadn't got there. And maybe at that point, you were starting to see your desire fully revealed to you. So you're willing
yet.
to jump through all these things and change your entire lifestyle. So the next piece I want to talk to you about, and I'm saving nutrition for last because I know that Omar played a really big role in all that stuff. But I want to talk to you about the stress piece. What
Yeah.
were some of the things that were really new to you that you started taking in? You said you started meditating. Was that brand new for you prior
Yeah, and I'm still
to
not good at it.
really
No, no, I was never good at,
sitting and still?
no. I think if I had known about breath work
Yes,
back then, that would have been a huge part of centering myself. And
yes.
but I did a lot of attempts to try to do it. So instead, what I ended up doing was just I was never able to clear my mind completely.
Hmm.
Just being peace and still, like it, even just doing that and not clearing my mind, but I really focused on my end goal.
Yeah.
That was how I meditated. And I kind of,
Huh.
because I had a lot going on in here, right?
Yes, yes. Well, of
And
course, with your
so,
profession. Yeah.
right. So I had a lot going on in here. So because I sucked at just clearing it, like the true typical traditional meditation, I
Meditation.
sucked at
Yeah.
it. I just had a thought. That's how I did it. I just
Yes.
focused on that this is what I need to do. This is what I want.
Hmm.
Okay, let me
Hmm.
just focus on being a mom. I'm going to be a mom.
Yes.
What's that going to look like for me? Oh my goodness. If it's a boy, what is his name going to be? If it's a girl, that's how I met. And so I would just lay
Oh,
down and
yes.
just have these thoughts and try
Yes.
to just focus on that one topic instead of all the other thoughts that were going. And
Yes.
that was my form of meditation.
That is so beautiful. And that's an aspect of visualization that you could have like a goal because you sound like a task-oriented human.
Yeah.
And so being in flow doesn't make sense to you yet. And it just takes practice to get there. But this was a way for you to keep that single point focus on your truest desire. And so even if meditation is new to you, just feeling like, what would it be like to be pregnant? I can't really connect to that. Okay, what would it be like to hold a baby that's mine? And feeling the
Exactly. You can connect to
emotion.
that. Yes.
Yes,
And so
yes,
that's exactly the types of thoughts. And I
yes,
do it every day. I
yes,
would do it every day. That
yes,
would be the exact type of thoughts. And it would make me feel so happy, like these
yes,
visions that I would get or these fantasies that I would allow myself to have
yes.
and coming out. And I do it for like 30 minutes, maybe 40 minutes, but I made sure that I did it every day and I felt better
Oh,
afterward, having done it. And that's
that's
something that I
amazing.
never did when I was practicing. I didn't have time to do that. I was always on the run. You know,
Right.
I'm my whole life changed when I decided to switch how I used my medical degree.
Yeah.
Um, and I'm so happy that I did
Wow.
it. I
That is
know
so
that I would
beautiful.
not have had Caleb if I didn't make that
Yes.
huge change in my life. Yeah.
Well, and I feel like I we could just brief past this. I do want to talk more on nutrition, but this is a really key aspect because when you're in this meditation space and you're cultivating the feeling of that desired outcome, you're allowing your body to feel that sense of connection, endorphins, the result already been done. And you said a key component here. You said, I allowed myself to feel. And what I see as I coach women is they've allowed themselves to go there, but then are scared that it's not going to work out and they retreat and they won't allow themselves to feel it because
Mhm.
they're too afraid of that attachment to hope. But that hope is actually a really big cord
It is.
into making it a reality, like
It
that
is.
true feeling that it is here for you now.
Exactly. Because I was so before I started doing this, it was so easy for me to get into a negative space and to just let that spiral like, oh my
Mhm.
God, I'm never going to be able to do this. My body can't do this. I'm worthless, da, 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 all that.
Yes.
You hold on to that so easily.
Yeah.
But if you look at it on the opposite, those empowering words, that brings energy as well too, the
Yeah.
right kind of energy. And it
Yes.
builds upon it. So it definitely is something that's very important. And it helped me. That's why I did it every single day.
Yes.
Like every day, I would look forward to having these visions and this time of hope, this 30 minutes of hope of
Hmm.
what I felt it would be like to be pregnant,
Yeah.
to hold a baby,
Yeah.
to baby. Do not discount that.
Yeah.
That in of itself is empowering.
It really is. It's a really big deal because if you think about what's happening on a hormonal level, like one is these release of oxytocin and endorphins and this feel
Yeah.
good and this high and this hope and it's joyous and this other one, it's either the downward spiral or the upward spiral and you chose the upward spiral because if you're not doing that, then probably your natural response is, "Oh my gosh, is this going to work? Oh my gosh, this is the 15th time. Oh my gosh, why is it going to work this? Now I'm 46, now I'm not 42." And
Yep.
so you're going in that all day long. So to take that time where you're like, nope, I am going up. I'm doing all the things to go up. It's here now. I'm making choices to go up. I'm going up, right?
Words and thoughts
Yes,
have
power.
energy and
Yes.
they have power and they change our reality. They
Mhm.
really do.
Yes.
Because if anything, if what you're thinking is how you're going to actually proceed ahead.
Hmm.
The words you're saying to yourself and the words that you're believing is what you're going to live. It's what you're going to manifest. I know coming into manifestation, but
Yes.
it is so true. There
Yes.
is no way that you're going to be able to get pregnant if you keep saying my body is shit.
Yeah. And I'm infertile.
That's
Even
it.
the word infertile, right? Exactly. I don't even like the word because I'll say roots infertility, whether your fertility journey is short or whether your fertility journey is long and has had a lot of wounds in it, it's still fertile. You're a woman, you are fertile. You are a woman, you are fertile. Like I just
Yeah.
am reminding women, you are a woman, you are fertile.
Very important. The thoughts and the words, the
Yes.
thoughts that we think, the
Yes.
words, the things that we say to ourselves, especially during this time,
Yeah.
they have energy.
Mhm.
They actually manifest outcomes.
Yes.
So it's important that it's positive. It
Yes.
really is. And
I love
that's what, because I had spent 2 years before that in such a negative space
it. Hmm.
that it was just, I looked forward to every day being in that positive space. And
That
so
is
I made time to do that. Yeah. Yeah.
beautiful. I love that was part of your routine. And then lastly, nutrition. So we talked about like the different nutrients. And now when you did your nutrition, your eating, was this just a general, okay, I'm going to add in bone broths. I'm going to add in more iron rich foods. I'm going to bring in maybe organ meats. I'm going to bring in,
At
was that
first, at
okay?
first,
And then you
we
guys got into different phases of the IVF treatment in
yes.
sync. Okay.
Yes, and trying to decrease inflammation. Like at first it was, seeing what's out there, what everyone's saying, bone broth and all that stuff. But
Yeah.
then I was really trying to target certain things. Like I felt that I had chronic inflammation. So I was really trying, and Omar and I would research, okay, what kind of foods and how we're preparing the foods to try to decrease that inflammation. You know
Inflammation.
what I'm saying?
Yes.
And then when I'm at different phases of my IVF cycle, like if I was in the phase where I know that I'm about to enter into an egg retrieval period,
Hmm.
I wanted to try to eat foods that would increase blood flow. I
Mm.
also
So
did
you're thinking red blood cells. I
and I
see.
also did acupuncture for the main reason of increasing blood flow to the ovaries. So I did acupuncture the whole like those last 2 years
Wow.
consistently, even through my pregnancy as well too. But yeah, so I was thinking scientifically as a doctor, okay, I'm gonna go enter into we're starting another cycle.
Hmm.
This is the phase that we're at in the cycle. What is it that could impede this cycle within my body,
Hmm.
and what can I do to try to counteract that?
Right.
And the biggest thing for me was chronic inflammation.
Right.
Um,
So you guys are
and
thinking omega 3s, antioxidants, CoQ10. You're thinking
yes,
of these. Yes.
and pairing that with like iron rich, depending like if I'm going into an egg retrieval phase, like iron rich foods,
Hmm.
things that's going to support the hemoglobin getting to the
Yes.
area that it needs to get to. So we got to that level at a certain point where we were doing a lot of food pairing and chronicity,
Hmm.
chronocycling with our food.
So eating the food in the certain order. So you were ensuring that first I'm going to have my protein, so I'm not seeing a blood sugar spike. Then I may have some carbohydrates afterwards. But
Right.
yes, but making sure that we're not spiking blood sugar. And so you're kind of thinking of all these things as you go through.
As you go through, and then even with the different cycle or phase that I'm in with my IVF treatment,
Hmm.
what foods can support what I need. So if so after the egg retrieval part, if I was going to go into an embryo transfer, okay,
Hmm.
what foods can I start to prepare and eat that's going to make my uterine lining plush and
Hmm.
just more receptive to that ovary? I mean, I got to that sort of level where I was like tracking where I was in the IVF cycle and then looking at how I could optimize it nutritionally with in order to try to increase my odds.
That's
And
so
so that's why it took us 6 months because at first we didn't know what the heck we were doing. We were just
yeah.
following what everyone else was, eat bone broth, pineapple core, all this foolishness that's like on, but it's actually not foolishness because pineapple has a certain
Yeah.
ingredient. Yes,
Is there more like around like progesterone, like so during the time where you were taking progesterone, where you're like, I'm gonna have more B vitamins, so I'm gonna focus on like the
absolutely.
fish, the eggs, the poultry, like this kind of thing?
Absolutely. I mean, I remember having like a spreadsheet
Yes.
where in order to like I kind of broke it down into different phases and then I had different food pairing as to based on the research as to what would optimize um that part of my IVF cycle. So I
Wow.
broke down to that sort of level. And so that's why I'm saying I think before we were talking about the fact that I thought that I could have gotten there sooner if I started to do that from the beginning because it took like a couple of months for me to really start to focus on, okay, what am I targeting here? Okay, I want to try to support decrease inflammation. I want to try to support my uterine lining.
Yeah.
Now that I'm in the 2 week, and I did it throughout the entire thing. Now that I'm in the 2 week wait, I'm trying to increase, the optimization of the embryo implanting and staying implanted, and
Mhm.
what kind of things can I do that? Well, I want to make sure that I'm supporting increasing progesterone and making sure, even though I'm taking progesterone exogenously,
Right, right.
IVF, I still was trying to, through my nutrition, support what components kind of helped my body produce progesterone. Do you get what I'm
Yes.
saying?
Yeah,
Yeah,
yeah. So it's like
we got to that level.
you weren't just relying on the system just to do it for you and you were passive. You
Right.
were actually really active in knowing it's that empowerment piece of like,
It
okay,
helped.
hold on,
Yeah.
like I could throw in some pumpkin seeds on this salad. I can make sure I'm having my cruciferous vegetables. I'm going to ensure that during this time where I'm also taking progesterone, that I'm giving my body that through the nutrients that I'm eating.
Absolutely.
That's
So
so
that's how we
beautiful.
focused on it. And then, the best part is that the food was delicious because I had Omar, being able to, if I said to him, okay, we need to, let's just say, let's do pumpkin seeds. Like, I need more antioxidants or I need more zinc or whatever. And let's add some more. He would figure out an incredible way as to how to make that
Yeah.
so that it's because sometimes let's just be real honest, sometimes eating well, it's not the
As
most
flavorful.
yes,
You're
it
like, okay,
really
I need
isn't.
antioxidants. So where's my vitamin C? But I don't want to just eat raw bell peppers every day. I want to,
Exactly.
yeah, it's like, I want,
Exactly.
yeah, okay.
And
So,
so he made it fun, he made it delicious, he made
mm,
it exciting. Like, what am I eating today? Knowing that we're getting these vitamin A, da, 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 everything that I need, but he'd cook it in such a way and produce these sort of recipes in such a way that incorporated all the nutrients I needed for that phase, but it was so yummy. And
yes.
so to I really was spoiled the last 3 months of my pregnancy. Remember, it was like during COVID, right? I had Caleb July 1st, 2021. And Omar closed down his restaurant the last 3 months of my pregnancy. And the timing was right because I even got too big to even drive. So he became my
Your
chauffeur, my
chauffeur, your
chef,
chef,
my foot massager,
your sperm
my
donor.
foot massager. I
Yes.
was pampered. But
Your
like
emotional
the
support.
food portion of it, I got at least like, well, even my snacks were gourmet snacks. It was gourmet, delicious, nutrient dense food every single day
Oh
while
my
I
God.
had him here with me. I
He
was
is amazing. I love him. He's so sweet. What a freaking
you'll
partner
be
to
speaking
have.
to him soon.
I
Yeah.
know. I can't wait to interview him and talk to him about his concoctions. And like, I'm a nerd, and we've made a cookbook, my husband and I, and it's based on like
So
just
cool.
how we've been eating for many years and helping people make it simple. Because for some people, they've never held a knife in their life.
Yes.
They've never held a knife in their life. So how do I teach people to start to eat healthy if they've only ever tore off a plastic and popped their food in the microwave? Because listen, that's the time what they was shifting to when I was a kid. Is like we have
Yeah.
lean cuisines now. We don't need to know how to cook. And so
Right.
like to reintroduce that, it's like it's a great conversation to start to have, and starting simple and batch cooking and these things in the modern day life, in the quick day and age where we have mom and pop both working. You had a full career, he has a full career. And so you
Yes.
end up dropping out these self-care practices that are really important for our overall health and well-being.
I ate so well. Because we were focusing on certain things, making sure that there was certain nutrition for both he and I, but the flavor and the joy of eating
Yeah.
was not gone.
Yeah, yeah.
And so that's one of the reasons why we decided, I think that we should be able to help people in the same way,
Yes.
especially people who are more inclined to cook, foodies, who kind of appreciate that sort of thing.
Yeah.
If you also are trying to get pregnant
Yeah.
and you want to optimize, we decided to try to help people doing an online program using both my skills and his skills and coming together in a program. So,
You so much for leading into that, because I
yeah,
definitely wanted to be sharing with everybody what you guys are creating. So you guys are in the process right now of
still
putting
building it
together.
out.
Yes, building it out. Now, are you going to have a community on school? Is it going to be on YouTube? I know you have a website landing page that has
Yes.
a place where people can sign up for when it's available.
Yes, and even that we are redoing because we just got involved with a health coach that we're really excited. They've been in this space for over 12 years. And so they're really helping us to really reconceptualize what we were thinking and how we're going to deliver it. There
Mhm.
is going to be a community because that's a huge part of any transformation.
Yeah.
So we will have a community for our clients to gather. We'll have live cooking sessions. We'll
Wow.
have live workshops. We'll have one-to-one sessions as well too. But what I didn't have back then that I will be introducing to my clients is functional medicine testing, so diagnostic testing. So I
Beautiful.
really want to add that piece in so that we get a real good insight into your body.
Right.
And the core things that we're looking at is nutrient, if there's any deficiencies.
Right.
Okay. We're looking at food sensitivities. So, do you have any food sensitivities and what they may be? Because
Uh-huh.
that can be leading to inflammation, which wreaks havoc on your fertility.
Yep.
And then toxin exposure as
Hmm.
well
Heavy
too,
metals. Yes, exactly.
metals, anything like that. And then on top of that, there is cutting edge DNA based testing where you can actually, based on your DNA, predict even how the pregnancy will go, predict so many different things. And so we've brought in also DNA based testing into the testing that we do for our clients as well too. So we're
So,
building out this program entirely. It's going to look like at least 14 weeks where it is both group and one-on-one and self-paced learning, and then the diagnostic testing, which will lead us to be able to develop personalized meal plans and a detox plan. And then after the 14 weeks, there's still 3 months of support that we can give while during those 3 months, you still have access to us. So it's like a 6 month sort of program.
that is so beautiful and powerful and so helpful for people on their journey of like feeling that individual connection with you guys, ask questions and to tailor it. And that level of detail. Looking at food sensitivities is huge, and or where are these people coming from? Like for me, I was raised in a cornfield in between Dow Chemical, which is like making all the freaking drugs, all the glyphosate in the world,
Exactly.
all these.
Um,
I was raised between that and a beet factory, which is like making all this sugar.
wow.
And so it's polluted. The sky, the
Yep.
air, the water, the ground, every piece of where I was raised is contaminated. And
Yep.
so it's interesting to like even think about that because you could be eating quality food thinking, oh, I'm eating my broccoli, I'm eating all this stuff, but it's contaminating and
It's
and it doesn't have
contaminating.
nutrients in it. Yes.
Exactly. So we want to make sure that we get insights as much as possible
Mhm.
to optimize your health. So I cannot guarantee that you're going to have a baby working with me, but I can guarantee that the chances of you conceiving is going to be exponentially higher. You're
Mhm.
going to have a safe space
Mhm.
to be in a community of people who understand and are going through the same thing and are learning from each other and supporting each other and having a mentor and a coach that lived it and went through it, both myself and Omar. You're
Yes.
going to have delicious, personalized meal plans, recipes. It's just something that I think it's not out there right now, and I think it's definitely needed. It's very
Wow.
unique, very boutique, customized, and it's going to be something that I feel um, will help people to either conceive naturally faster,
Yeah.
or if you are going through IVF, save you money and time. Um,
Seriously.
because at the end, you're going to end up to be healthier.
Yes.
And there's no one that can tell me that you being healthier from where you started point A to point B does not increase your chances of you getting pregnant. Like I lived it.
Yes.
So,
And I
yeah.
love that. And I was gonna one of my questions I was gonna say to you is as a physician and thinking, I mean, you weren't sitting with people beforehand in your role as a physician, but like how valuable do you think that is for people in visiting with their OBGYN for checkups instead of me just being like, okay, how are you feeling? And me measuring your belly and sending you out the door, having these sit down conversations because preeclampsia is on the rise, gestational diabetes is on the rise, all of
Yes.
these complications is on the rise through pregnancy. And I really feel just sitting today with one of my clients right before this conversation, he said he had 16 stents put in his heart, and not one doctor ever talked to him about his nutrition, not one. And
It's
I,
because of the state of health care that we're in right now. Honestly, it's a shambles and it's not set up to truly help people have a transformation.
mm,
It's really set up for a passive sort of treatment plan.
mhm,
And for some people, it's going to get you some results, but it's not going to get you ultimately to where you need to go and where you want to be
yeah,
because you're not an active participant in it. You're being passively told what to do or passively given you medications or passively having surgery done on you, but you really aren't a huge factor in that transformation. You aren't learning skills or you aren't changing your habits per se,
mm.
not when you have a pill to pop, right?
Right, right,
Or
exactly. You think, oh, I got high cholesterol, I just take this pill instead of me being like, I got high cholesterol. And before even that, having those conversations, okay, you have gestational diabetes. Before I send you home, these are the steps you're going to need to take to ensure a healthy pregnancy for you and this baby.
unfortunately, a lot of doctors,
Yes,
they are so under pressure from so many different external sources
not enough time.
that there's not enough time. And I'm being very honest.
Yes,
There's just not enough time to have the crucial, transformative conversations
conversations. Yeah.
that are needed for
Hmm.
people to be active participants
Hmm.
in their health. And that's the only way that you're going to see change and to get to where you want to get.
Well, I
Like,
think it's beautiful. You're
wow,
stepping in a different role. Like you were in this role of I'm doing a procedure and now you're swinging around and kind of filling that gap. And that's
yeah,
kind of see how I see where functional nutrition and counselors and coaches come in to fill that gap of like, yes, you had your doctor break down what these labs told you or knew what procedures we're going to do, but now you need somebody to help you become that empowered person so you don't repeat that same pattern. So this condition doesn't get worse. We're
Exactly.
actually teaching people how to become active participants in
Yes.
their lifestyle, changes.
That's the only way that transformation is going to occur is
Right.
not for them to be passive
Yes.
in this, but to be active. And even the tests that we like that I have curated that this is the group of tests that we're going to do for every client that goes through. These aren't tests that I would have run as an OBGYN. I didn't these are special labs that run these special tests. They're not common medical tests, but
Right.
they will allow greater insight
Hmm.
than what your OBGYN will be able to get through the typical medical tests. I'm being very honest. As an
Right.
OBGYN, I
Yes.
didn't have access to these types of tests.
Yes.
But the insight that it will give me will allow me to create a very personalized and delicious
Yes.
game plan for you with the help
Yes.
of Omar.
Oh,
Yeah.
I love that. I love that. And you guys are so sweet because you say delicious. Like, because
Delicious.
I really appreciate that because so many people's resistance to change and how they're eating is, well, taste good. You're going to take away taste from me, right?
Oh, it's gonna
And
be good.
we need to, yeah, no, they're gonna believe you. They're like, okay, you got your chef there. You're telling
Yeah.
me that like this food is gonna taste good because there is an emotional piece to food. And if we're not addressing that piece of how it is our comfort in ways, then we're just lying and expecting people to just drop these old habits and start up with a new. But if you're saying to me these foods are gonna be delicious, they're gonna be like, let's talk. Let's talk. I
And
really
we're gonna also help them with other things, just like what you help them with mindset, sleep,
hmm
moving your body. You know
hmm
what I'm saying? All the other things that are involved for you to have the transformation.
I love that.
And all the other things that unfortunately when I was practicing, I didn't have the time or the bandwidth to do it with every single one of my patients. I literally could not.
Right, right. If you have 10 or 15-minute sections to move through people, there is no way.
That
One of
is
my great,
literally the amount of time you have.
yes,
It's the way that our healthcare, and it's not your doctor. Your
right.
doctor is not different from any.
They're
This
just a
is how it
player.
is
They're
across
just,
all of America
yes. I have a
and
girlfriend.
United States, like Canada, North America. This is how healthcare is set up within North America.
Yes, yes. And I had a girlfriend. We went to we studied on cadavers together, and oh my God, we had so much fun. She tried to steal the penis, Well, I mean, we had so much fun together with our dead people that we studied on, and we are grateful for those bodies because they were amazing to teach us science. But gosh, we had fun together, and she is now a doctor, and she said, Carly, I went to school to be a doctor to help people. And
Yeah.
she's just sobbing with me on the phone, and she's like, she is now overweight, has high cholesterol, has anxiety, is on all these different drugs. She doesn't have time to take care of herself. She doesn't have time to take care of her patients. And she knows she needs to write a prescription. She needs to get a diagnosis out there. She has 15 minutes to turn this over and to write down notes before the next person walks through the door. And she knows that that person's going to be returning because she wasn't able to actually help them.
Yeah.
And she's like, what do I do though? She's like, I now have $150,000 in medical expenses to pay off. What am I supposed to do? And so it is a system that like not taking the time where people used to, oh my gosh, back in the day, the doctors used to come to your patients' houses
Yeah.
see how the people were living and you
Yeah.
could give them feedback like no you shouldn't be having this but on a personal note you would establish that connection and that relationship to have these deeper or harder conversations and it's just not the world that we're in right now.
And I really do feel that physicians and they should incorporate health coaches into their medical practices
Hmm.
because they need to look at the reality and not keep lying to themselves that the 10 minutes that they're spending with the patient is really going to help the
Hmm.
patient. No.
Yes.
But this is their reality right now, and it's not anything that they can do to change it just
Yeah.
because this is how the system's set up.
Right.
So then what you need to do in order to really truly help your patients is then in place a health coach in your practice so that the patients do have that accountability. Okay. They have that. They're on a path of transformation using your medical principles. They can still be taking that pill,
Right.
but they also need to learn all the other skills,
Yes.
all the things they
Yes.
need in order to have this to be a transformative and long-lasting
Yes.
change.
So we're not going downward or we're not even staying equal anymore, but we're actually kind of starting to incrementally make a
Exactly.
difference in your health. Right. Exactly.
Exactly.
Beautiful. Wow, it's
So,
incredible what you guys are creating. I'm really grateful for you being here and showing your story. And I'm excited to share with Omar as well as we bring him on it, the chef who was able to feed his bride and like just keep you in your bliss so you could just stay in that high vibration while you were doing all the other work. It's
yeah.
so beautiful. I'm grateful for you being here, for Caleb coming, for Omar and the work that you guys did together. And I also feel that a whole nother conversation could happen just between the support of you guys just being so intertwined with each other on this journey and just and I really believe that when two people come together as one with the same vision, with the same heart, it's inevitable. It's inevitable what's going to happen. So just seeing that couple coming together with that same mission and you guys did it on all levels together, which is so beautiful. So I'm just
He's
it really
amazing. He
yeah,
really is amazing. I lucked out
yeah.
on so many different levels. Yeah.
I love that.
Amazing father too.
Oh,
So,
beautiful. We need more moms and dads like you guys in the world, just leading with your heart on fire. Thank you so much for being here.
Carly, thank you. I enjoyed my time with you, man. I love talking with you. I can do this a lot. So, and for me to come on again.
Yes.
But in the meantime, even though we're building it out,
Yes. Oh, and thank you.
there are still ways that if anyone wants to work with us one to one,
Mhm.
there's ways that we can do that. Omar and I have figured out until we have our group coaching program up and running, we will be doing one to one, and that can
Okay.
look many different ways. We can do
Yes.
testing, we can do personalization of recipes and meal plans. We can figure it out until we actually have the group program up and going. So I'm going to give Carly the information as to how we can be contacted, as well as the wait list where you can provide us your details for waitlisting for our group coaching that will be coming out in 2025.
That's so beautiful. And it's just around the corner. So if you guys don't want to wait till then, listen, if you're thinking about growing your family, it is October right now. So November, December, and January, and you're thinking January birth, and now is the time to work on these things.
Absolutely.
Right. So those 3 months before for the male and the women. So this is a time you could optimize your chances in working with Dr. Renee and Chef Omar. And so I will make sure that you guys have access to their information in the description box, her email and or number if you want them to contact you that way, and also a link to their website where you guys can be on the wait list for when this program is launched in January, just around the corner. Thank you so much, Dr. Renee.
All right. Thank you, Carly. Bye now.